Okay, I think can you all hear me? All right, back there? Hear me? Okay, good morning, everyone. We're starting at 8:37 a.m. If you have a gadget that makes noise, please mute the sound. If you have any papers, please hand them to Jim Curran, who's Sergeant at Arms. Will the clerk please call the roll?
Bell.
Present.
Curran.
Here.
Freeling.
Present.
Harrison.
Here.
Hinkleman. Legere.
Here.
Meek.
Here.
Scott.
Here.
Boland.
Present.
Werfel.
Here.
Yarborough.
Present.
Elliott.
Here. I heard from John Hinkleman about an hour ago and said he wasn't going to be able to make it in today. So you won't have him in committee. Minutes from the 12th. I don't know why it's not the 19th, but the 12th. Moved by Meeks. Is there support?
Second.
Supported by Majerick. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Those minutes are approved. Did we not have minutes from the 19th?
Last week we didn't have a committee of the whole.
Oh, that's right. That's right. Okay. Requisition review. Annette.
Acting. Oh, that's the contract modification. There was something on there. Yes, Berrien bus or RISA. Could you explain that? I know we have a contract, so they're paying us or we're paying them?
We're paying them. Brian, do you want to comment more about that?
Yeah, so.
Thank you.
Yeah.
It's was it
It's the one we're paying RISA.
$398,000?
Yeah, so
Transportation.
to the board, to the commissioner, so the way this deal is working is that our busing staff, we have shifted from temporary employees, moved them to RISA. RISA is then employing them, billing them back to us so they can continue driving our buses. RISA is covering all their expenses and then billing us back. We pay RISA, they pay the bus drivers. The benefit of this arrangement is then the 1,000 hour cap for temporary employees is no longer a concern.
Mm-hmm.
We're not carrying the employee liability on our books. We're simply reimbursing RISA for the use of those staff. Does that answer your question?
Yes, I remember us talking
Yep.
about that, or that they were our contract, RISA. Okay, thank you.
No problem.
Any other questions?
All right, thanks, Annette. Let's see. Scheduled discussion, we have a Graham Woodhouse Award. Chris Martin.
Right.
There you go.
Is he an employee? Okay.
Yes, good morning. My name is Chris Martin. I'm an associate planner at the Southwest Michigan Planning Commission. For those of you that are unfamiliar with our organization, we're a regional planning agency based in Berrien, Cass, and Van Buren counties, 1 to 14 across the state of Michigan. We do a wide range of planning efforts in our region. We're headquartered down in downtown Benton Harbor, but we work in the Tri-County area. We do a wide range of transportation, economic development, non-motorized recreation in this case, environmental planning, hazard mitigation planning, and a wide range of other initiatives, like we're partnering with the county right now on broadband initiatives. I'd like to congratulate the cooperation we have, and I'm presenting this on behalf of the Southwest Michigan Planning Board, which we have a few of our board members also overlap here with the county board, which is great. Back in 1987, there was our board put together the Graham Woodhouse Intergovernmental Effort Award. It was in honor of former Dowagiac Mayor Graham Woodhouse, and it's presented annually by the Southwest Michigan Planning Commission Board. This was actually awarded back, I believe, in December 2020 via Zoom. And so what we've been doing is kind of going and making the rounds, and Commissioner Dave Bullrath invited me today to come and present this formally for our partnership efforts. The whole goal of the awards like this is for intergovernmental cooperation by local units of government, NGOs, tribal governments, and this really hit all the mark with the Paw Paw River Water Trail project. It's really recognized for being innovative, utilizing resources well, and helping do great cooperation. In regards to how it was awarded, it was actually awarded by the board, and there was a wide range of projects on the table, and this one was selected. You can see kind of our methodology and how it was selected, all the key marks that this project hit. Just a few examples of some of the past award recipients. You can kind of take a look here. I'm not going to walk through everything, but everything from partnerships in regards to helping improve our wastewater systems, non-motorized mapping efforts, recreational tourism in regards to access to wineries, improvements on watersheds, regional master plan efforts, non-motorized recreation, and also bridge efforts, bridging two counties together. And the winner is the Paw Paw River Water Trail project. If you're not familiar with this effort, it's been going on for the past 5 years. The Paw Paw River is over 68 miles, spanning two counties, Van Buren and Berrien counties, all the way from the village of Paw Paw, all right down here as it connects right here in our harbor to the St. Joe River.
Where it starts.
Yeah, it's a beautiful stretch. Over 9 townships, 7 cities and villages, and 1 federally recognized tribe were award recipients. The Paw Paw River Water Trail project really is really a treasure in our region. I mean, everyone knows the St. Joe River, but the Paw Paw River is kind of a really hidden gem that a lot of people are really enjoying getting out and paddling on, what we've noticed over the past 5 years. This water trail project goes through a wide range of very unique, small rural towns, beautiful forest lands. There's many different types of segments, from the popular segment over in Dave's jurisdiction over between Watervliet and Coloma, to really remote stretches over by the village of Lawrence, and also really cool areas right downtown here in Benton Harbor by the golf course and the like. So it's a really a wide range of really great recreational opportunities. And these things just don't happen overnight. It's taken a lot of coordination and patience, and our just the effort that we have here with the local units of government stepping up, working with our tribes, working with NGOs. It's really kind of a testament to what we can do as a region. I mean, we're known, as the lake, the Southwest Michigan, everyone focuses on the lake, but our rivers help feed that lake, and we need to take care of them. And the more people we have out there enjoying them, the better. And so it's really amazing. And now everyone says, well, the river's pretty easy, right? You just get out and paddle. Well, there's actually a lot more that goes into that. It takes a lot of work doing pathway maintenance in a sustainable way to help with fisheries, doing that the right way, working with contractors, doing signage. There's also been a great improvement of parks for Berrien County, for instance, the great work you're doing at your park up in the Watervliet area, the Paw Paw River Park, and how that's expanding. That's a really great asset. There's also 2 other parks that have improved in Haggard Township as well, and the village of Paw Paw. And so by creating an access like this, you're also enhancing these local communities' access to recreation. And it wouldn't have been possible without a regional trail effort. And people are actually helping share the funding, which is great, right? Cooperation. So helping share that funding for promotion materials and also pathway maintenance and improved signage. This is an example of some of the signage and trailheads that are located on the river. These are some great wayfinding efforts to help people navigate. There's also a website at pawpawriverwatertrail.org for more information. We have a Facebook page as well too. And we really are commending, today the partnerships that we have with the two road departments in Berrien County and the road commission in Van Buren County. And we really like to congratulate the Berrien County Road Department for the efforts. I've worked with Kevin Stack personally over the years, and I really appreciate his willingness to partner with us. In this case, for this specific project, it's actually helping wayfinding along the roads and putting signage up so paddlers know where they are. And the great effort is we're working with our local fire departments in North Berrien to help coordinate with them for responses and for also just great coordination so people know where they're at, know where to get off. It's really a great asset. And one thing I want to touch on too is that this recreational opportunity that's being partnered is used by residents and tourists alike. We found out that a lot of people travel from our surveying efforts less than 10 miles to get to their access point. So it just shows the value of retaining local recreation opportunities that really have a very low cost. There's a lot of liveries for rental. It's also a great way just to get outdoors and recreate, socially distance, right? And another great opportunities for that. And I just want to really run through real quick before I hand off this award on all the partners here that received this award. The Village of Paw Paw, Paw Paw Township, Waverly Township, Lawrence Township, the Village of Lawrence, Hartford Township, the City of Hartford, the Pokagon Band of Potawatomi, Watervliet Township, the City of Watervliet, Coloma Township, the City of Coloma, Haggard Township, Benton Charter Township, Cornerstone Alliance, the City of Benton Harbor, Two Rivers Coalition, a local nonprofit, the Van Buren Road Commission, Berrien County Road Department, and Surrett Nature Center. Having all those people work together over 5 years really is a testament, and we're continuing that effort. The Southwest Michigan Planning Commission is been helping over the years of coordinating and making sure this continues to happen. So with that said, I'd like to congratulate the Berrien County Road Department. And Kevin, I got a plaque for you right here. So thank you very much. Yep.
Perfect, thank you.
Then I brought some flyers here for people of the audience and some informational cards. Just a quick little summary. These are some of the recreational opportunities that I guess I can, Dave, you want to pass these down, everybody? And for anyone in the audience, if you'd like one, this is just kind of some information about Water Trail.
I'd just like to add at the last meeting on the Paw Paw River Water Trail that our fire chief for North Berrien Fire said that the signs that we put out on the river identifying where they're at has already helped in locating several of the rescue operations to get out there because they've had a lot of trouble finding where they were on the river. With those markers, they've been able to say, the X marker, and they were able to find them right away. So it's already working the way it was intended. So that's a very good thing.
So thank you for the opportunity to present. Thank you, Brian.
Thank you.
Thank you, Chris. Kevin?
Give a speech?
All right, okay. Understood. Okay, our next item is a COVID-19 update with Courtney Davis, the health officer. With her is Rex Kabaltica, the county's resident, or not in resident, but physician who is aiding the health department. As you all remember, Dr. Johansson retired, and Rex has stepped in and made it a seamless transition. Committee business is 22 minutes away, and we need to start at 9:15 sharp because you got a lot of stuff to do to get back here by 10:30. So Courtney's going to make a presentation, and then there's going to be a minimal amount of time for some questions after. So Courtney.
All right, thank you. I will make sure we leave some time for questions. We're going to look at this morning, and the community context we're going to discuss really fall along these 5 areas when we're making our decisions and we are working through guidance and recommendations and actions at the health department. These 5 areas are really important. So looking at that community transmission, our hospital capacity, what we're seeing for vaccination coverage, that protection layer, how we're able to really intervene and have that early transmission intervention, so case investigation and contact tracing. And then continuing to learn about COVID-19, especially our Delta variant, monitoring who are those vulnerable populations and how they are being impacted at that given time. So the first we're going to look at is our data that really talks to us about transmission, what we're seeing in our county, what types of case definition we're seeing. So this first is a bit familiar to us. We've looked at this a lot over the last year. This is the 7-day rolling average for confirmed and probable cases. That top graph, if you're looking at that when you have this later too or now, that is the course of the entire pandemic. The lower one that is kind of blown up there for you, that is the last handful of months, just to give you a little bit of a closer view. As you can see, over the last handful of weeks, our 7-day rolling average has continued to increase. Those last few bars there, we are now at 31.7 per 100,000. So what that looks like on a day-to-day basis is about 29 cases on average a day. And we have been seeing that increase the last 5 to 6 weeks. About 5 weeks ago, I was telling you it was under 5 cases a day. So we have seen that increase over that period. So this is our percent positivity. Again, something that we have looked at frequently. We've just now been able to overlay that with the CDC's levels of transmission. So under the yellow, that would be considered low. Between the yellow and that orange, that is our moderate. Orange to red is substantial. And then anything over that red is high when we are looking at our percent positivity. Again, this is for the course of the pandemic. You can see where those different peaks were. We know we had kind of that first initial big wave in the fall over November. And then we had some in the spring. Right now, where our percent positivity is going, we're really starting to mirror that spring wave again, seeing those increases and settling in. Right now, we're at about a 12% positivity. The other that we look at is the 7-day cumulative rate per 100,000. So this doesn't mean the entire cases we've had in that 7 days, but it's the rate per 100,000 based on the cases. I'll show you that graph next. Again, we have those CDC transmission layers in there, but you can see that that has continued to increase over the last 5 to 6 weeks. And we are starting that climb similar to that wave we saw in the spring. So again, our numbers have been increasing. We're still seeing that by the cases coming into the department, as well as what's being mirrored in our region and state. So this next slide looks at these same data points again, just in a bar graph. Able to give a little bit of a different view. That top bar graph that you see that is the actual cases that we have had each week. So that is the cases that have been reported to the health department. Again, you can see that we have had pretty significant increase over the last 4 to 5 weeks. Those bottom two are the similar graphs that we had just looked at. One is the 7-day cumulative case rate, and the other is the percent positivity. Right now, we have seen that steep incline and that continuing to grow over that time. When we looked at this a year ago, if you look at our overall cases, right now we're hitting into the 200s. A year ago, 3 weeks, we were 62, 68, and 59. So again, I think that this is definitely an outcome and a result that we are seeing from the higher transmissibility of the Delta variant. We know that that is impacting transmission and how that is active in our community. So we are watching these numbers, but we do have this 4 to 6 week trend of increasing time. So here's another that I know you have these slides and we'll be able to dig into a little bit more, but just looking at our cases, so this is Berrien specific, looking at our cases by age over the months of the pandemic. So you can see that if you go back and see where we've had peaks in our percent positivity, when we've had peaks in our 7-day cumulative case rate, that those cases have increased. Again, though, I think that what is noteworthy right now is if we look at June and July, those numbers are really low. That final last column is the total. You can see that we were kind of around 125, 150, both those months. They were definitely all-time pandemic lows for us. However, to date in August, we are now edging into 600. So that's a pretty significant increase of cases when we're looking month over month. And then correlating with that, we've seen every age have that similar increase. So again, just trying to provide a little bit more context of who we are seeing those cases in, what is that looking like over time, and how is that impacting our residents here in Berrien. So that looks at our transmission, and we are seeing that increased transmission. We have that data that looks at. We also need to continue to look at our hospital system and really understanding what's happening there. So every day we do at the health department get communication from Spectrum Health Lakeland that lets us know what are they seeing, how many cases, as well as just overall hospital context. Because while it's important for us to know how many COVID-19 cases that there are, it's also important for us to know how is that impacting the overall system, because there are other things, there are other needs that are important for them to be able to address and to make sure that they're not having to compete for that time. This is a couple days old. I did now look at it again this morning, so sorry not being able to flip that, but we are, over the last 2 days, we have moved into the 20s. We have 23 individuals in the hospital with COVID-19, and our ICU number has now shifted to 3. So as of this morning, there are 3 individuals in the ICU. Again, just from perspective, we have seen this increase over the last 4 to 5 weeks. At the beginning of July, we were having very low numbers in the single digits in the hospital, none in the ICU. Up until a week ago, we had none in the ICU. Now we are seeing 2 and 3 regularly over the last 4 days. Just a few other things as we look at our health system and that we have conversations with our health system is just what is their overall ability to surge? I think we've talked about this in the past with the course of the pandemic. It's really important for a health system as your cases grow to be able to surge, to grow their capacity, to be able to serve additional patients. Right now, that does look different than it did a year ago for us. There are different space limitations in our health system and our hospitals, as well as just staffing differences. I think we all know this from just our climate as a whole, but they are struggling to have the amount of staff needed to be able to even pair with that surge. So those are other things that we are keeping in mind, making sure that we are being attentive to, as well as just their younger admits. So over the course of the pandemic, about every quarter that has passed, the hospital does look at the age of individuals being admitted to the hospital, and that average age has continued to decrease. Early on in the pandemic, that average age was really settling in the 70s. We now, over the last quarter, have really moved that into about 59 being the average age. So we are seeing younger individuals hospitalized, continuing to monitor that with Spectrum Health Lakeland. So then when we look at our vaccination rates, we are continuing to see people seek vaccination. This week we did receive the Pfizer vaccine has been approved by the FDA for 16 and older. That is good news. We hope that will drive some additional vaccinations. Right now, if we look at our overall community of who is eligible, so the 12 plus, we're just shy of 56%. So we've been sitting in that 55 for quite a while, but we're slowly trying to keep increasing that. And then if we look just at our youth, that 12 to 19, we're about 34%. So still needing to really increase that area. The Pfizer approval for FDA, again, hopefully will continue to breed that confidence. We are seeing that these vaccines are effective against COVID-19. They are effective against the Delta variant. We are seeing them do what was intended of decreasing severe illness, decreasing hospitalizations, and decreasing deaths. And that is a really good testament to the strength of these vaccines. So we said Delta a lot over the last couple of weeks, but just a reminder that Delta variant is definitely present here in the community. We have had more of our tests be identified as the Delta variant in the last couple of weeks. That has increased quite rapidly. We knew it was a matter of time when we saw it in other states and then our region, but it is a much more contagious variant. We are seeing that it can spread to many more people. The viral load that individuals have is much higher than past strains. Similar to the last slide, but vaccines are effective, so that is good. That is still a key layer of defense when we are looking at this. We are encouraging anyone who had COVID in the past to still be vaccinated. We know that the vaccination immunity adds that extra layer of protection, especially against Delta, that original natural immunity may not provide. So continuing to make that encouragement. And then because we are seeing that increased transmission, because our narrative has shifted, really encouraging folks to continue to layer back on those mitigation strategies that we know work. So masking while we continue to get vaccination out there, while we continue to learn more about how Delta is interacting with our population. So all of that data right now is really bringing us to public health actions that are important for our community. We really need to be able to keep those cases low. We do have an opportunity to still layer on prevention and mitigation measures that will ensure we don't inundate our health system, that we don't see new vulnerable populations severely impacted by COVID-19. And we provide time for us to really understand what does Delta mean for our community, and are there other variants on the horizon that we need to be mindful of, that we need to learn more about. So at this time, that is really wearing a face covering when you are in an indoor setting or even an outdoor crowded setting. It is important to be able to block that chain of transmission. We know that face masks are dual benefit. They protect others from the wearer, but they also protect the wearer from getting germs from others. But it is primarily about that source control. It does best about keeping your germs, your illness to you. So that is a really effective measure at this time. Of course, vaccination, don't delay, get that vaccination, as well as we know we've been hearing things this week. We are starting to give that additional dose at the health department. That is for immunocompromised. So individuals who are immunocompromised, we are encouraging to speak with their healthcare professional, their primary care physician. It is always important to do that, just to everyone's unique, but we are doing that at the department. That's that third dose 28 days after your second. And then we are starting to prep for fall plans for that booster dose. The booster dose will be the dose that is recommended 8 months after you did the original 2 series. So we are making plans for that this fall, after that September 20th date, when we will have kind of that first wave of folks who have been 8 months post-vaccination. And then the others, which really haven't gone away, we've continued to talk about washing hands. Staying home when you're sick is truly still one of our best things. Just don't go out if you don't feel well. Don't go to those crowded settings. And then continuing to work with our community for isolation and quarantine, really cutting down that chain of transmission. So why this all matters, we know that we are quickly approaching, and some people have already gotten there, the new school year. Being able to really prioritize in-person learning and social connections is key to a healthy community. We believe at Berrien County Health Department, in partnership with our schools, that in-person school-based learning is the best option, is the best thing for our students' health, our teachers' health, our community's health. And so all of these actions, what they help us do as they are layered on together, is eliminate out of school time. This is just a reflection of last year's cases and contacts. So in total, during the last school year, over 12,000 quarantines and isolations were served. That's a lot of out of school time that we don't want to see this upcoming year. We want kids to be in school, in the classroom. We do have that divided a little bit by spring and fall, and are working to look at that monthly too, but we saw a high impact of contact when we're able to have additional mitigation layers like masking. That really allows us to not apply broad strokes, especially for quarantine. We're able to narrow that down and apply smaller parameters around that positive case. That allows more kids to stay in school. And then we know it cuts down transmission overall. So in theory, you're seeing less of those cases as well. And so when we look at these numbers, this is really a driving factor. We know that social isolation, not seeing friends, not doing sports are not healthy alternatives for our students. We want to do every prevention layer we can to avoid any of that impacting our school year this year. And I'm actually going to have Dr. Kowalska, if you don't mind, coming up. And also we have different impacts to kids. We have direct and indirect. And some of the impacts we know are direct. They're health driven. And Dr. Kowalska is going to talk a little bit about those impacts that are to kids. But the other thing that I think is noteworthy on this slide is just our pediatric hospitalizations and how those are changing. The blue slide that you're seeing there, that just looks at the underlying health conditions associated with pediatric hospitalizations. And now we are seeing 46% of those do not have underlying health conditions. So by all means and purposes, healthy adolescents still being hospitalized by COVID-19. So that's something we are certainly looking at. Dr. Kowalska.
Thank you, Courtney. And Doctor, we've got about 5 minutes to get to committees. Thank you.
Let me, instead of going through some more numbers, let me just emphasize Courtney and the team there at the health department, they're crunching these numbers. This is a locally driven health department. We're not doing what does COVID do over the United States. We're looking at what has it done to our kids here in Berrien County. We track that day by day, week by week. If we make recommendations, it's because there's a local impact. I just want to underline that. Secondly, with the rise that you're seeing, it's easy to predict the numbers that we had in quarantine are going to rise because that happened last year with masks, everything on. If we don't start laying those mitigation factors in place at the right time and take them off when it is appropriate, we want to be flexible. We're going to see those numbers. So the indirect effect is the biggest effect we're looking at right now. Missed schools, missed experiences, and we want to do that. That's why we're crunching all these numbers. I think I'll just leave my remarks to that.
And actually the last two slides, so we have time for a few questions. So I will leave to you. They just look at masking and impact in schools, as well as I know there have been lots of questions about breakthrough cases and the impact overall. So there's a slide that shares some of that data with you, but I can answer those questions after you have a chance to review. So we have a few minutes.
Thank you, Courtney and Dr. Kowalska. We've got a couple minutes if there are any questions. If not, and yes, go ahead.
And that's just on the questions, because I know you have a list of questions from us. Where does that stand on getting those questions back?
That is with, it's just being polished. We have that with our communications team, just getting all the hyperlinks to make sure that they work. That will be out this week.
Perfect, thanks.
thank you both. Spent a lot of time and effort on this to put into this presentation. And it's helpful that was on the eve of school starting. We'll stay tuned. Hopefully in days ahead. Public comments. Time or someone wants to make comment or do other business. Yes, ma'am.
Melissa Clapper, St. Joe Charter Township. I just want to thank you all for providing the information this morning. I know that this is not an easy decision to make. However, having been in the classroom for 26 years, and especially with little ones, you know, they depend on us. We are their voices. They don't have those voices. They don't have the ability to be immunized with this disease, with this virus. And yes, all parents want to make choices that they think are best for their children. But in a classroom of 26, I have to make a decision on how to take care of everybody. I don't get to pick and choose which kids are there. So I appreciate all the effort that you're doing. I know that you have been under tremendous pressure that we can't even begin to believe what is going on. So I thank you all for taking care of it. I urge that we at least do masking in the schools. So that's my report. That's my statement.
Thank you. Anyone else among the assembled multitudes who wishes to speak? Other business?
Mr. Chair,
Yes.
so I've watched some of this going on. I have contacted Buildings and Grounds. I know it's a little warm in the building today. We'll do our best so that your 10:30 meeting is a little more comfortable.
Thank you.
Do we need to do anything with finance about this issue?
We're gonna ask for an AC unit.
Just wondering.
A window unit,
Yeah, we're gonna get a window unit.
and then a kit, you know, the insulation
Oh,
kit.
insulation
You gotta
kit.
keep the air
Yeah.
sealed. Right, let's adjourn to committees and back here at 10:30.